Hamlin.
Thank you. How do I get the slides to start? Thank you. Thank you for that wonderful introduction. I have to say I am very honored and very humbled to be here today. So thank you for the invitation. Let's see if this works. So I'm just like any government employee. I have no conflicts of interest, and what I say are my own personal views and not that of Uniformed Services University, the Department of Defense, or the United States government. So a little bit of background, which you probably already know, but I'm going to put it in a little bit of perspective. We were just at AMSIS yesterday doing some of this. So we currently know in 2022, women compose 17.5%. The 23% data just came out, and it's a little over 22% of uniformed forces are female, rising about 3 to 4% every year. And then when you include the National Guard and the Reserve Forces, that rises even more. That's about 22% of their forces, and they're rising by about 4.5 to 5% every year in the female population. The perspective is you add up the total force of females in the armed services, and it's more than the entire Navy put together. Isn't that a wonderful number? That's the kind of statistic that ties all those pieces together. The history, we know that women served in World War I and World War II, but it wasn't until the Women's Armed Service Integration Act in 1948 that allowed women to serve in the official capacity, and then in 2013, women were able to serve in combat roles. A little bit about what we do at USU in women's health, and I've got another slide that puts us together in somewhat of the history. In 2017, USU got a palm from Defense Health Agency to our Vice President for Research office, and she dedicated it to women's health. And she moved it to nursing. So I'm a nurse. I'm also a nurse midwife. I also practice once a week at Walter Reed. So, you know, if I'm going to do the research and teach the classes, I need to know what's happening in the clinical and with our military women. So I'm going to add that piece in there. In 2023, I was named the inaugural director of the Military Women's Health Research Program by our president, Dr. Woodson. And I am so happy to announce that in January of 2025, Dr. Woodson signed our charter. We are now the Center for Military Women's Health Research and the only center in the Graduate School of Nursing. So a little bit about past activity of Uniformed Services University and funding military women's health. And I've got a slide put together that shows the amount that both USU and DHA has funded. And then I'll show you where you can access all that data because it's public. Military Women's Health Program has funded about $10 million in military women's health grants since 2017. The university has funded almost $63 million between fiscal year 20 and 25. We sponsored webinars. USU has a total of 76 grants, 32 presentations, and 152 publications growing every day on the topic of military women's health research. Here's some of our accomplishments that we've just done in this past year through the program and the center. We worked with the prior administration and the executive orders to make sure that federal funding prioritized women's health research, in saying that any study that we want to fund has to include men and women, and if you don't include women, you need to justify that. So I use the example, I'm studying prostate cancer. I'm not including women. We have worked on informing evidence-based decision-making. We did the NDAA 2022. They wanted to know about breast cancer in the armed services, men and women. and if burn pits had an influence on it, and what it was compared to the civilian population. That report is on OPM. My name's not associated with it because it was a government publication, but that came out last year. And now my colleague Rachel Gabor and I are working on getting the internal scientific data published. We also were part of, based on my midwifery background, the National Academy of Medicine looked at healthcare disparities. And one of those sessions, which I think is still online, I organized looking at disparities in perinatal outcomes among uniformed women. And now we are really working on strengthening interagency collaborations with our other federal government partners. I was saying yesterday I was at AMSIS. We had a 3-hour symposium. Thank you, AMSIS. And we had researchers from USU, VA, CDMRP, and Tri-Service Nursing Research Program. So trying to bring different entities together and get out of those silos. We've really worked in the research space in a lot of silos, which isn't a bad thing, because everybody is doing excellent research, but I think we've reached the nadir where it's time to combine forces and look at where people are in similarities to do and grow the research. And that's been one of the funnest, my daughters will tell me that's not a word, part of this role is talking to people, meeting linkages, who's doing work in the space, where can we link people up, who's looking for colleagues. So I probably do 2 to 5 of those meetings every week. The other piece that we do is knowledge dissemination. I'll show you where you can find our webpage and what it looks like, but here's the link to it. It's a little bit hard to find on the USU webpage. You have to go to USU Graduate School of Nursing Research and read down and find it, and it's not highlighted. And so I will talk about that. That was part of the initiative that we did on our prior, and I just love her so dearly, the former acting undersecretary for Health Affairs, Shailene Mullen, had asked us to put that together. So it looks at USU funding. I now know that there are 5 military treatment facilities, IRBs, and so I pulled data from those. Our U.S. Vice President for Research Office and my colleagues from Defense Health Agency. Let this slide blank. In December, the program, now the center, co-sponsored with my colleagues in DHA a stakeholders meeting. We were asked by Health Affairs to pull together a group of all the different organizations, and it turned out there are like 38 within the federal government that funds research, to ask them what their priorities are for military women's health research. We did the SWOT analysis, what they were funding, where they saw the needs were. AI is a wonderful thing because it told us the same thing the rest of us who did it by hand and what the priorities were. But we have 4 categories, and we're going to work on getting that published, that whole process. But one is operational health, which ranges from menstrual regulation to environmental exposures, chemical exposures for uniformed women, postpartum fitness, and the big topic these days is impact on menopause, because more and more women are staying in their careers further on in life, and they're not the 30-somethings anymore. The second topic is injury and musculoskeletal health, not a surprise here to anybody. Looking at stress fractures and load carriage. One of my colleagues at CHAMP found when she looked at boot camp, and I'm not going to do her justice, that women in basic training had stress fractures a little bit later in basic training. Men had them earlier and healed. And the midwife in me wasn't surprised. If we've got clinicians in here, it was women on Depo-Provera, which is black boxed for stress fractures. So it was the contraceptive use that linked to the stress fractures in basic training. Looking at pelvic floor disorders, my dad is a Navy with service-connected disability, but I learned that men and women who jump out of planes, regardless of ever having a baby, have pelvic floor injuries. And myself and Dr. Kulmas published one of those papers. Bone health and force protection in the field. The third topic is reproductive and mental health. What are the effects of stress, of deployment and stress on families? And polycystic ovarian syndrome. And the last gap was actually data and technological gaps, looking at toxicology results, data exchange, etc. So I've got a prettier slide in a little bit, but this gives you an idea of where the gaps are that we have identified through USU in military women's health research. This is our internal funding. So if you are at Baylor or San Francisco and have funding, I may not know about you. This is our internal stuff. If you have it, send me the information. We'll add it to our database. So in 6 years, we funded about $152 million dedicated to military women's health research. And you can see where our gaps are that we've identified. We actually put a call out 3 years ago for our funding mechanisms, looking at cardiovascular and women's health. We got 0 letters of intent in that, and we're still at 0 in funding. Pain, substance use, misuse, and substance use disorder is another gap. So I talked about our center that's signed. So what are we going to do? We met with our smaller groups and have identified our mission. We are going to promote, manage, and coordinate research that will improve the health of military women through interdisciplinary collaboration and policy recommendations. I sit on several joint VA, DOD, and DOD groups, the Women's Health Policy Heckline, Midlife, Reproductive Health, etc. Our vision by 2029, around the corner, will be nationally recognized as a leader in research on women in the military, and that we will be the central hub for coordination, policy recommendations, knowledge translation, and operational support. Our group gets $1.6 million a year, so we are not going to be the sole funders for military women's health. But we would like to be the central hub to be able to connect people and disseminate the work and turn it into practice and policy. So we do have research funding. I'll talk about our 9 projects that we funded, that we currently have in our portfolio. Collaborative partnerships, I've talked about our work with the VA primarily. We're working with the NIH Office of Research on Women's Health. Eventually we plan to do podcasts with them. We'll have somebody from the DOD on the topic, and they will bring somebody in that they funded non-DOD to talk about those podcasts. They're tentatively slated for the 2nd or 3rd Thursday. As soon as we all get permission, we will begin to move forward, looking at menopause, musculoskeletal injuries, violence against women, fitness. So those are all in the portfolio we're planning. The content expertise, how do we link clinicians up, especially with researchers, and how do we turn the data into clinical practice guidelines? And education and knowledge dissemination. So this is a little bit of this with our lines of effort. And our strategic plan is done. Dr. Woodson has signed it. We are having our first official meeting next Tuesday with our board of advisors, so looking forward to that. We have a program manager who manages our database. I'm very blessed that we have a half-time biostatistician who is just awesome in our statistics, and we lend her out, for lack of a better word, throughout the university to help them with other research projects. And this is what we hope to do when we are fully operational across the DoD, MHS, and other non-governmental partners. Education and training that apply to military women's health research, to workforce and professional development. I mentioned some of our co-groups. So last year, we stood up a joint VA-DoD Women's Health Research Collaborative. I am the DoD representative, and Dr. Amanda Borski, if any of you know her, is my VA colleague. We do have a roadmap, and last week we hit send. We are submitting 2 GIFs. If you know about GIFs, joint incentive funding. You have to be VA and DoD. They have $15 million, and I have heard that their budget is not being cut this year. And we're hoping to create an evidence map. If you follow the VA and their literature, they just finished a women's health evidence map to make recommendations on where their gaps are. So we're going to do one for the DoD. And we're also going to sponsor a women's health research conference to bring people together, to connect, to look at the gaps, to move forward. So we're very excited about those initiatives. And that's where we are moving forward, looking at other outside funding sources. We're going to keep maintaining that database. And yesterday we had the 3-hour in-person symposium at AMSIS. I'm an invited speaker at MWS25. I'm from the Midwest, and I can't even remember whether it's Cleveland or Cincinnati. Somebody in here probably can remember. And we are going to have a panel to talk about this, but Ms. Kimberly Lam, who manages the women's health policy portfolio, will speak about how military women's research is translated into policy. Major Kathleen Pompier, who is the medical director for the Women, Infants, and Children clinical communities, is going to talk about how we translate that into clinical practice guidelines. And then Dr. Jill Brown is one of our funded researchers in menopause, but she also started the virtual menopause care line through Walter Reed. So she's going to talk about how all of this translates into practice. So if you're going, come find us. So this is a little bit about the funding, but I wanted to bring back, I know some of you know whose name I'm going to take in vain, Dr. Carl Friedel and Dr. Kate McGraw. They had history pieces. I did not know that in 1994, Congress mandated a women's health research center, and it was stood up. And in 1994, 1995, USU had a whole seminar on it, and all of it was published. And then that history got lost. So we hope to keep it going and maintaining it and keep it going forward. I've already done this. So this is a little bit of the portfolio that we have funded, very vast array, even through our portfolios and the presenters yesterday, from people who are looking at TBI and ALA to decrease the effects of TBI in women using mice studies, to qualitative grounded theory study, talking to women experiencing infertility in the military. Our VA colleague looked at firearm safety and suicide risk and safety plans in the VA. There is just so much work that needs to be done, can be done, is being done. So we have funded a study on musculoskeletal. Dr. Bill Caterino is looking at uterine fibroids and treatment and how it relates to pain. Dr. Krista Hyland is looking at low back pain, the continuum from active duty to the VA population. We have a funded study looking at eating disorders in women. And what else am I on here? Monica Lutengorf is doing a pregnancy intervention and looking at stress during pregnancy and whether her intervention not only decreases stress by psychometric tools, but she's a pathologist looking at placenta to be able to do those pieces. We have somebody looking at basic sanitation practices in the deployed environment. We are evaluating the walk-in contraceptive clinics. We funded that work, and the work that will start this fall is midlife and menopause. This is a prettier chart of what I've already showed you. This is the link to the website, so this is a screenshot of it. Our publications, presentations. Is anybody here familiar with the REACH database also? So it's through Auburn University. They also have a funded grant. They have much more on the publications than we do, because they do ORCID and all those other pieces. We collect the internal pieces. And the unique thing about this is the funded work that's not necessarily on grant.gov. And I have PAO approval and external affairs, so this is still all up and open. So if you know of pieces we don't have in here, please let me know so we can add your great work to it. Doing okay on time so far? Almost done? Okay. And I've already talked about it, our plans for the future, be the hub for female-specific research with the ultimate goal of providing operational support to improve the health and readiness of our military women. Here's my contact information. Colonel retired. I always laugh because her retirement date was April Fool's, and she wouldn't believe she wasn't going to get redeployed until April 2nd got here. But she is our Associate Director for Research through HJF. And I will open it for questions if I still have some time. I talk a mile a minute, so.
We have to move on to the next presentation, but
Okay,
around.
I am around. Thank you so much. Again, so honored.